video. This is Naughty Aguilar at Functional Patterns, and for today's video tutorial, I'm going to show you guys how to change your squat so that you don't feel pain on your knees and your lumbar spine. The squat is a very popular exercise, possibly the most popular other than a deadlift within the fitness industry. I myself will preface this video by saying that it's not the most important exercise that you can do. In fact, it definitely takes a backseat to things that involve any type of unilateral movement where your feet are one behind the other, anything that involves rotation in the trunk, anything that involves extension in the arms and flexion in the arms. Those types of movements should be dominant in your training program. Why? Because anthropologists, the science of anthropology, has pretty much concluded that human beings have adapted to run, sprint, and throw as a priority. We were spear chuckers, we were walking, and we were throwing quite a bit. Those are the types of movements that we did the most. But since I know people are going to be doing squats quite frequently, and I still recommend them, it's not that it's a bad exercise, that positioning is very important. I'm going to help you guys along the path to make sure that you don't hurt yourselves while you're doing it. For starters, you guys have heard me discuss doing a squat right here with the legs moving in the sagittal plane. The reason I orient my squat that way is because it's going to help us open doorways to different types of movements in terms of rotations, in terms of frontal plane movements. When your feet are straight forward, that tends to promote better balance in your body to move in 3 planes of motion. I'm looking for 3-dimensional movement with the body. So when I'm talking about preparing you into a squat, I'm thinking about what you use the most. We're not talking about squat depth either. I'm only talking about what you're primarily going to be using when you're actually in movement. Typically, when you're in movement, you're not usually going to go anything beyond a 90-degree angle, so therefore we're not going to change that too much. In terms of getting hamstring tension or gluteal tension on that eccentric phase, we do it all the time here at Functional Patterns. That's what we emphasize when you go into about a 90-degree squat. The thing keeping you up in that regard is going to be the muscles that are going to hold you up substantially will be your hamstrings and your glutes. We won't go too deep into that quite right now. We're going to focus more on myofascial release, and that's what we're going to start with, is releasing the rectus femoris. The rectus femoris is a muscle that tends to be very restrictive on the eccentric phase of your squat. Most people in general tend to load their quadriceps in a concentric fashion, specifically as they're coming up on the squat. Since most people who do a squat for the first time tend to dip their knees forward substantially in this regard, it tends to lead the body to orient that tension to bring yourself up concentrically through those quadriceps. So with time, the brain develops an association to using the quads, and we get stuck using those same muscles. Now, why is that bad? The quads are a sagittal plane muscle. Glute max, hamstrings, are actually a 3-dimensional muscle. They move, well, the glute max especially works in all 3 planes of motion. If I can take my tension from here and put it back here, that will enable me to move in different directions, because the glutes can actually rotate, they can abduct, right? They can even adduct, but they can also extend, whereas the quadriceps only extend. So if we're going to have a more tensionally balanced squat, we don't want quad loading if we're looking for 3-dimensional capability. So what we're going to do is actually go in there with the lacrosse ball, laying down face down in this fashion. I'm going to take the lacrosse ball and bring it right there, dead center on my thigh. Just think about the alignment of your knee and going right to the middle. You just push wherever your ASIS is, that little bone on the front side of your pelvis, and the middle of your knee. You kind of just calculate where that is on the middle of your thigh, and you should be able to land that lacrosse ball right at the spot that you need, okay? So I'll be just laying down here, kind of in a plank position, and I'm going to allow the weight of my body to fall onto that lacrosse ball. Now I can tell you to do knee flexions and extensions potentially to create this into an active release. The problem with that is the active release is sometimes can be a hindrance to the depth of the myofascial release that you're looking for. I would recommend, as you're staying here, looking for more depth, try getting all the way down to the bone, because odds are most of your distortions on your body will be at the bone. So really trying to get deep. This is probably going to be uncomfortable if you've never done this before. If it's not uncomfortable, make it uncomfortable. Try getting deeper on the tissues, and that's going to give us a much better effect out of this myofascial release technique. Okay, so I want you to hang out there probably for about 2-3 minutes bare minimum until you feel the tissues release, until you feel the pain subside a bit. Then we're going to go to the wall over here next, and we're going to attack the gluteal fold. Now, the reason we're going to attack the gluteal fold, most people when they squat, if they're if you've never tried doing a squat before, usually they're going to dip again into those knees like I had mentioned before. And the reason that you're not going to have the inclination of doing that, what we would call a posterior pelvic shift and a hip flexion while you're going into your squat, is simply because when you've been sitting at a desk all day long, you've been incorporating knee flexion. Most of us sit at desks, we're in a car, we're on a bike, whatever that may be, we're usually constantly in this knee flex position. That creates a shortening in the hamstring tissues, especially if you're in a car and you tend to hunch, then you're going to create a posterior pelvic tilt. That's going to create a massive restriction out of the tissues right here at that gluteal fold region, right? So if we come down and we're going to create an eccentric potentiation with the tissues here at this proximal point, we're going to have to lengthen them coming this way with our glutes. So if you think about me dropping my pelvis forward this way, the fibers are going to shorten concentrically, not advantageous on the knees at all. And as we come back this way, now we're lengthening the fibers there, okay? So now we're taking the pressure off the knees, and we're also going to take the pressure off the lumbar spine. If I have a good eccentric potentiation here, that means it's going to be dropped off my lumbar and it's going to be put on my glute max and my hamstrings where it's supposed to be. So as I drop that back, that's going to change our mechanics. If we can facilitate a lengthening of the tissues here or establish a different type of connection that involves a little more length, that means we're going to get a better eccentric potential out of these hamstrings, which will then lead us to getting more explosive capabilities as we come up on the upward phase of the squat. So I will then be sitting down here at the wall. I'm going to bring my back completely flush to the wall, as flush as possible, even if I need to bend my knees. Some of you, if you're really, really tight, the males that are probably in their 40s and 50s, this may already become very problematic. You even just being able to get to the wall here, maintaining somewhat of a neutral spine, and having your legs in this position. If you are one of those people, then just bend your knees, drop the ball underneath, and very slowly, as you maintain your spine flat to the wall, you're going to then institute a slow knee extension until you feel that pressure there. You can slowly roll back and forth. Sometimes you may feel your leg go numb. If you're feeling your leg go numb, that means you're probably crossing the sciatic nerve. Try mobilizing. Try not to stay still here. Otherwise, you may end up feeling some of that numbness within time. So we're going to go into some cross friction here as I go back and forth to release that gluteal fold. Okay? We just look for the more uncomfortable places. We're looking for those toothache-like sensations that I've mentioned prior. We attack those toothache-like sensations until they don't feel like that anymore. If there's no more pain and that toothache is pretty much gone, it's an indicator that the tissues are probably retensioning in a different fashion. Okay, so what we're then going to do is switch to the other side. And I remind you, even with the Rectus Femoris, to do the same thing. Always try getting both sides. With that said, you probably will feel one side more than the other. Another cue to look out for here is, again, anteriorly tilting. Don't find yourself in this hunch position. You guys see how I'm rounding here in my lumbar spine. That's going to lead to no release here. If you get the pelvis and you anteriorly tilt it, you're actually lengthening the fibers of that upper posterior chain in terms of the hamstrings and glutes, and you're going to get a much more effective release out of this spot. So we kind of just move back and forth until we break up those tissues. Okay, now we're going to go into a quick mechanics check. Okay. Because this is a very common problem that many people have when they drop down into their squat, that as they drop down, they don't know how to get their knees back. They don't know how to establish this association of getting their knees back. If I tell them, okay, go and do your squat, or if I tell them to do a pendulum squat and they start bending, usually they end up doing this kind of stuff. And we got to think not just in relation to we don't do barbell squats and functional patterns. Putting a vertical pressure on the spine is not something that we do, so I'm going to quickly throw a disclaimer out there. We are not recommending barbell axial loaded squats. They're terrible on the lumbar spine. They're terrible on your joints in general. The spine usually already deals with too much compression already. I'm not going to be focusing on that at all. So we are not doing anything that involves an axial load on the spine, which are those barbell squats. So with that said, what I'm looking to try and do here is establish as much potential to get my glutes to bring me up in this fashion here. Okay? Now, if I start trying to take somebody into a jump squat or a pendulum squat or anything that involves some kind of a kettlebell swing, typically what they're going to revert back to is doing this anterior knee shift and this knee flexion, and their weight's going to tend to go to the balls of their feet. We need to eliminate that as much as possible so that way we can begin to learn how to associate a tension on the glute max in this eccentric phase position as we're dropping down into that squat. Okay, so what we're going to use is a feedback system over here. I'm just going to be using a super bend I got my trusty Kaiser here. You can just use a band. This is not complicated at all. All you need to do is just have some kind of a post, door anchor, and just hook on a band. Okay. All we're going to do is we're going to feed that problem while you drop down into that squat. And just put this right below the knees. I'll be stepping back. Feet are going to be about hip width apart. TVA is going to remain completely intact. Our rib cage is going to be nice and open. We should be feeling some good intra-abdominal pressure as we go through this. If you can associate a slight tension through your standing neutral position while you're here, and you can feel a little bit of that gluteal activation, I want you to hold that tension. Then we're slowly going to begin to drop down into the squat. I'm going to add myself a little bit more weight. Okay. And all I'm going to think about as I'm dropping down, the knees are going to come forward a slight bit, but I don't want them to come too far forward. I want to start to begin to use my muscles, right, in my posterior chain to kind of propel me back in this direction. We're going to be getting a little bit of activity in the hip flexors, no doubt, but that's going to be okay. As long as there's a tension being reciprocated from the glutes and the hip flexors, or antagonized, excuse me, we're going to be okay. But all you're going to be just thinking about doing is slightly creating a small extension of the femur. So we're going from flexion, a little bit of extension, and we're going to just drop down into our squat, very slowly potentiating that tension back here. Another cue that you guys can look for to slowly get you there. As you drop down into your hip flexion, you're going to do a little anterior pelvic tilt. It's just almost like you're taking your sacrum and you're bringing it up. Okay? We want to be careful to not go into a lumbar hyperextension here. As you guys can see that curve, that's then going to facilitate a concentric shortening of these tissues back here, shortening them. That's going to end up leading to this crazy tension. Not good on that iliac crest, not good on the lumbar spine. So we want this to be nice and neutral as we drop down. But with that neutrality, we're going to incorporate a little anterior pelvic tilt while maintaining this navel retraction, keeping our pressure on our heels. As we get to the bottom, your goal should be that you're able to hold your torso about neutral to your shin bones, and you're going to institute a little bit of an anterior pelvic tilt there until you begin to feel your hammies work at the proximal region to the hip joint. Okay, so you guys will see how I can kind of control that. This is going to help you establish this connection within that posterior chain, and now you'll be able to have a substantial amount of power that you can generate through that. So really this is just acting as a feedback system to prevent your knees from coming forward. This will be crucial when it comes to doing things like kettlebell swings, pendulum squats, any types of dynamic movements, jumping. You don't want your knees to be caving forward. Now, can we go too far back with the knees? Yes, but that's another video for another time. Anyway, those are 3 techniques that will help improve your squatting mechanics, your functional squatting mechanics. Again, I'm looking for 3-dimensional capabilities. Movement that only applies to vertical planes does not really translate very well to our reality. We have to think that whenever you're in movement, you have to battle momentum. As soon as I take a step laterally, I have to battle that momentum to send me the other direction as I move back and forth. Those are horizontal force vectors. When we start talking about doing barbell squats, things of that nature, that's only applying to a vertical force vector, and most of the time we are not battling those types of forces when we are in our when we're in a functional reality specific to sports, running, most things in life in general. This squat right here is preparing you for horizontal force vectors, moving you laterally, sprinting. It's setting you up to have better athletic positioning. And that's really going to help you translate into better movement when you go into your whatever sport that you want to go into, or sport or activity. Anyway, I do hope that you guys found this video to be useful. Be on the lookout for more in the future. This is Naughty Aguilar at Functional Patterns, reminding you to train intentionally and not habitually. Take care.